progressive. So far we like low and moderate intensity exercise. Seems like we prescribe those, right? What about when we get to high intensity? So high intensity is really largely the domains of zone 4 and 5 here, the yellow and red. We're getting to 90%, 95%, 17, like we're getting close to maxing out, not completely maxing out, but getting close. We see increases in blood pressure, variable cerebral blood flow. That's what CBF is, cerebral blood flow. So increases in blood pressure, variable cerebral blood flow, increase of free radicals. So that's not a good thing. Increased free radicals, increased cortisol, and decreased brain glucose. And so those are things that we already, that's just anti what we want in concussion. We don't want more free radicals because that's already what's happening in our brain. We don't need more cortisol because we want good neuroplasticity. We don't need decreased brain glucose because we already have decreased brain glucose. And notable changes in mean arterial pressure. So that's the blood pressure note for people who are interested or who kind of are privy to this field. Notable changes in mean arterial pressure. So once we get above 150 millimeters of mercury, that's kind of the threshold for cerebral blood flow regulation. And when we see those swings, we get dysregulated blood flow. And just know that cerebral blood flow kind of plateaus. Regular laminar flow plateaus at around 60% of your VO2 and decreases thereafter. Technical notes, if you're a patient, you don't really know exercise physiology or medical terms, don't worry about it. Just know that this is not something you want to do in the acute stages of your concussion recovery because we see increased free radicals, increased cortisol, and decreased brain glucose levels, and we don't need that. What about longer duration exercise? So longer duration exercise was categorized as anything longer than 45 minutes. It's likely not a good idea, and it's probably not even well tolerated in concussion patients. And I say it's not well tolerated because I've yet to meet a hockey player, a football player, a soccer player. I've yet to meet anyone who's gone 45 minutes and said, yeah, I made that through without a headache, or I've made that through without a symptom flare. Most people feel something after the 30-minute mark when they're in the acute stages. So not once they're recovered, not once we've passed the Buffalo treadmill test, but I've even have like ultra endurance athletes, like triathletes, 70-kilometer, like Ironman type people who their whole like sport is going way longer than 45 minutes, but even that 45-minute mark is not well tolerated. So that's just kind of throws out 45 minutes and longer from the get-go. But what we see here physiologically is there's increased oxidative stress, increased cortisol, impaired cerebral blood flow regulation, decreased brain glucose, and altered autonomic function. So just to maintain that pace, just normally in healthy people, we have all these changes happen. Because it's a big stressor on your body to just move for that long. And so we see altered autonomics, we see altered cortisol because we need to maintain fuel. So it's not a bad thing. It's just what our body does to adapt, but it's not how we want to adapt in concussion. So all of these things have the potential to increase neuronal apoptosis. So neuronal apoptosis is programmed cell death. So your neurons program their death via the free radicals, attenuate BDNF and neuroplasticity via the cortisol, and reduce brain energy availability, which is already a deficit in TBI. So we don't like these mechanisms. What about resistance training? So this is needed among football players, hockey players, lacrosse players, rugby players. It's needed among just people who want to be healthy and fit. So what are the notes on it? Resistance training, generally, we see cerebral vasoconstriction via the myogenic mechanism in response to increases in blood pressure. So basically, the fancy way to say this is the simple way to say this is imagine going to squat or going to deadlift or going to press. When you kind of brace and you Valsalva and you push, all those big muscles, your lats, your pecs, your quads and glutes especially, will constrict blood flow. And you'll get this massive increase in blood pressure. So we can see when you deadlift, we can see a normal blood pressure is like 120/80. We can see blood pressures increase well above 300 during a deadlift. And that massive pressure backup of blood pressure, that massive blood pressure changes, like your brain has to regulate that blood pressure. So I'm stumbling over my words, but when you go up to like 300, 320 millimeters of mercury, your brain, you don't want to flood that and just pop all your vessels. So you got to kind of constrict. And we see that alters blood flow. We see increased oxidative stress. We see delayed vagal reactivation because strength training, especially like powerlifting, Olympic lifting, things that have a lot of neuromuscular demand, a lot of motor recruitment, a lot of coordination, we'll see higher sympathetic tone after that. And we don't really want that in concussion recovery because concussion patients already have higher sympathetic tone. So that increased sympathetic activity, increased cortisol just to maintain the fuel, and you've got adrenaline dumping, your adrenals are working. So you just got this kind of heightened state that we don't want in concussion recovery. So in terms of load, if you're looking at your 1% max or your 1 rep max, so your 1 rep max is, if I went to go do a squat, it's the most weight that I could do, like 1 clean rep, and that's it. I cannot lift any heavier than that. So if we say, let's just for easy numbers, if that's 100 pounds, God, I hope I could squat more than 100 pounds. But if it's 100 pounds, 30% of my 1 rep max is 30 pounds. So if I was squatting 30 pounds, there's no significant changes in systolic blood pressure, heart rate, cerebral blood flow. That's probably safe. The second we go 40 to 80, we start to see impaired cardioautonomics. So that's when we start to see more sympathetic, parasympathetic changes, more sympathetic, delayed parasympathetic. We see increased cortisol at around 75% of your 1 rep max. So if that 100 pounds is now 75 pounds and up, I start to secrete cortisol. 50% 1 rep max or higher, we start to see increases in systolic pressure. The combined effects decrease cerebral blood flow, which is your fuel, increase neuronal apoptosis, maybe, and attenuate plasticity, maybe via these cortisol mechanisms. So that's probably not great in early concussion recovery. I'll make a note, I think in the next slide. No, so coming up, I'll make a note about how we can kind of look at strength training and what I'll recommend at the end. So putting this into the context of concussion. Remember that this data was in healthy, not concussed patients. So like I said in the beginning, the implication is if it's not great in a non-concussed patient, then it's probably not great in a concussed patient. But also remember, exercise is medicine. We literally could not create a single drug that touched as many diseases and as many mechanisms as exercise. Exercise is beautiful. It's amazing. It touches so many systems, does so many good things. There is nothing bad about resistance training. In fact, there's a boatload of good stuff about resistance training, even going really heavy. There's nothing bad about high intensity training. In fact, there's a lot of good about high intensity training. There is nothing bad about exercising longer than 45 minutes. In fact, you get the point. Exercise is medicine. It's just context of how you use it.